afternoon and welcome to today's OR Today webinar, Two Sides of the Same Tray, OR and SPD Working Better Together. Today we are joined by Surgical Solutions Betty Casey, SVP of Clinical Operations, Nate Peake, VP of Operations, and Wade Wilson, Regional Operations Director. OR Today would like to thank our sponsor, Surgical Solutions. Based in Overland Park, Kansas, Surgical Solutions is a trusted leader in on-site surgical support services, specializing in non-clinical surgical services, staffing, and sterile processing. They deliver tailored solutions for a broad range of surgery centers. So for more information, please visit surgical-solutions.com. Today's webinar, as usual, is eligible for one continuing education hour from the California Board of Registered Nurses, and you can obtain your certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1CE certificate, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Okay, let's kick off today's webinar by giving away one of our OR Today live lunch bags to the attendee that can tell me the answer to the following trivia question. November is Pancreatic Cancer Awareness Month, so what color ribbon has become the universal symbol of pancreatic cancer? Answer now using the questions feature on your dashboard, and I'll reveal the winner and the answer at the end of the webinar. We'll have a live Q&A at the end of today's presentation, so please submit your questions anytime using the questions feature on your dashboard. As I mentioned earlier, our presenters today are Betty Casey, Nate Peake, and Wade Wilson. So Betty, you may begin whenever you're ready.
Okay. Well, thank you very much, Linda, and thank you everyone for finding time, and I know your very busy day, to join us today at this webinar. I'm hoping that you'll find the information to be of value and that we all have the opportunity to learn together. First of all, I would like to apologize. I'm off camera right now. We unfortunately had an electrical power issue, potentially from a car accident down the road. And so I will be on my phone doing audio. So again, I apologize. As soon as they get the electricity up, I'll be jumping right back on for it. A little bit about myself. I have been with the company now for over 5 years in Surgical Solutions, have been a customer and an advisor to it since 2012. So definitely believe in our model. I'm very happy to share some of our work experiences. For myself, I am a nurse by trade, have been in the profession for over 35 plus years. I say that because it's a little more than 35, but it makes me not look as old, so it makes me feel better for it. Have mostly worked in my career in the surgical services area, and am a big believer in trying to restore our overarching mission to everyone who works in procedural areas, and really to bring back and restore the joy of work to healthcare professionals. I will hand it off right now for my peer, Nate, to speak a little bit about who he is, and we'll continue on. Go ahead, Nate.
Yes, my name's Nate Peake. I've been in the surgical and SPD fields for a couple of decades now. Just really, this is something I'm very passionate about, this topic of how we bridge the gap between the OR and SPD, and how we create a really a lasting uniform vision for both departments. So this is very great, and look forward to this discussion.
Thank you, Nate. All right, Wade, a little bit about who you are.
Hi, everybody. I'm Wade Wilson. I've been with the company for about 12 years, in the medical field for about 15 years. As you can see, born and raised in Western Kentucky, currently live in Chicago, but been all over the country, working in the operating room and sterile processing, endoscopy, so a bunch of different areas of the hospital. So yeah, this is, again, the topic that we're going to go over today, something that is very important to us and things that we have been working on, all three of us over the courses of our careers. And we're going to talk about some things that, we've seen work and some problems that we've seen, but good to see everybody.
Thank you very much, Wade. Appreciate that. And Wade's right. This is something we're very passionate about. We live in this every day, and we work really hard with our partners to really try to make a difference for it. So hopefully we'll all be able to share a couple of things and take away some of this from this learning today. A little bit about who Surgical Solutions are. We're actually experts in the surgical ecosystem. We say ecosystem because it's not just one department. Just like we wanted to share on this particular webinar, is we want to show everything from two sides of the tray, not just the one side. It takes a true partnership and having areas to work together who are passionate about the same mission for it. We're also a trusted partner in hospitals and ASC teams. We love to work in the SPD areas, OR and endo, and we pride ourselves on focusing on quality, efficiencies, and the outcomes. We are very clinically focused on what we do. Again, we drive everything that we do in our work and what our teams do in the work when we're working with hospitals across the country to ensure that we're taking care of everyone's family members when they come up to have a procedure as if it were our own for it. And when we talk a little bit about breaking down some of those silos and developing some of those best practices, hopefully you'll get that theme from that. Also working hard to improve in our company the physician and healthcare provider satisfaction and leading mostly in cultural redesign. The work is very complex, and we like to be able to share some of those things that we're working on to make the work a little bit more easier and give a little bit more efficiency to the flow. We're going to just remind everyone about the CEU that's offered at the end. Just as Linda had stated, you'll get a survey. Please make sure you fill it out. Many of us have to have CEUs every year or more every 5 years if we're certified in CNOR for it. The learning objectives for today will be based by the end of the session. We're hoping that you have had an understanding of the challenges and differences between managing an OR and SPD teams, that you're able to apply some leadership strategies to align goals and processes across both areas. And number 3 is being able to identify some common silo pitfalls, including communication, staffing, and compliance. And last but not least, being able to take some actionable steps to confidently lead both teams in OR and SPD. So we're hoping that you get that from this 45-minute long webinar to be able to bring back something to your teams. With that being said, we're going to have a lot of dialogue today. We have the PowerPoints here for you to read, not for us to read off of it for you, but we're going to discuss what it's like when we're in the field and some of the things that we've learned. So one of the first things that we're going to talk about today are what are the pressures that everybody's facing? And I also ask for you to put things in the chat for it, because lots of times we go through this and we want to hear your story, what you're doing. So please feel free to write in the chat anytime you have a question or anytime you want to make a comment. So I'm going to hand this off to start with Nate to talk a little bit about some of the things we're looking at here for some of the pressures that we're facing for it. So Nate, you want to start us off on what's out there that's causing us heartburn and causing us a lot of issues?
Thank you, Betty. I appreciate that. You know, one thing that I really see across the board is the critical staffing shortages that we're seeing right now. I haven't seen this really in my lifetime is what I'm seeing right now, and that really has put a damper on patient care and that we're giving to the patients every day. One thing that I see that the critical staffing issues cause is people tend to rush the processes in sterile processing, creating 100% preventable mistakes and things like that. And we all know that we have been in those situations where a tray gets up to the OR, it's open on a back table, bioburden is seen, and then you have to break down the entire back table. And then what happens then is we have to break down that back table, cannibalize other case cards just to get that case going again. And what that does is that can crush your entire day. That's really one of the main things that I'd really like to dig into today is the critical staffing issues and how do we solve that problem with retention of those key staff members that we need to have every day.
That's a great point, Nate. Thank you for bringing that up. Wade, would you like to add on some of the other pressures that we're facing?
Yeah, I mean, kind of like what Nate said, I feel like I think we all remember it. It was about 5 years ago. It was called COVID-19, and I feel like that exacerbated like our healthcare system. You know, a lot of people went to traveling, a lot of people retired, looking for better opportunities at other places, making more money. And so hospitals are really trying to catch up really of like their staffing. They're trying to be more competitive, facing financial strains and resources, updating their processes and protocols for Joint Commission. They're being more stringent. They're constantly changing what they're looking for. And again, what Nate said too is like the case delays. You know, it's if you don't have the right amount of staff or you're facing pressures in that area, you're not going to be able to get everything done, and that's going to cause delays in the OR. They're not going to have what they need because of the staffing issues. Causes operational inefficiencies and workflow disruptions and everything. And again, I see broken and unusable equipment. That goes back to financial strains. It's like, yeah, you know, you need the equipment, but you know, how much do you have in this year's budget?
Absolutely.
Good point. And also the good point about relating it to what we've all experienced through the COVID. Certainly it changed who we were, how we reacted, and we still have a lot of growth to do from that particular point for it. Again, if you have anything you want to add, please add it to the chat, and we'll go on and talk a little bit more about the next slide, which we talk a little bit about common trends. All right, so let's look at the common trends. Hopefully you're seeing it now on your screen for it. Wade, do you want to kick us off on this one? I know that there's some passionate trends here that you're excited about that you want to share about things that we see. So you want to start us off?
Yeah, I mean, a couple of them on here that really like jumped out to me was the top left and top right. Transition to robotics and not enough space. Robotics, a lot of things are moving, you know, went from open to laparoscopic. Now it's laparoscopic to more robotics. You started out with one robot, then two in your hospital, then three, then four, and they're very large. You know, hospitals, a lot of you are going to be working in hospitals that are old, that need updating. And again, we go back to the financial constraints. It wasn't built to have these like big robots taking up your room. And then everything that comes with the reprocessing, the robotic instrumentation. There's a lot of things that go into it, the soaking, the sterilization, I mean, it's so much that goes into it. It's a longer process too. And that's something that we're transitioning to. And like I said, not enough space. You know, the robots are big, but if you look into your operating room and your sterile processing departments, you're just looking for where to put everything. You know, it's like
that's a good point.
Was probably perfect size when they built the hospital 20 years ago, but now, you know, you're getting more and more equipment, you're getting more and more IFUs that you need to follow, and more staff that you do need, and you do need that more space to process everything. What about you, Nate? Is there anything that sticks out to you?
Yeah, I think one thing that just one blaring thing that I see a common theme across the board, right? I talk to SPD directors, managers, SPD professionals across the board, and it's just lack of professional advancement. That one's just blares at me, because the common thing that I hear is, you know, we bring these folks in, we train them up, we put the time and effort in them to get their certifications and train them properly, but then they go on for traveling agency or something like that, right? How do we cultivate and retain our best talent, right? And I think that that's a conversation that we need to start having, is what can we do? I know there's only a certain amount of management positions open, or lead positions, or instrument coordinators, but there's other people that may not want to get into management, but they still want to advance their career. So we really have to think outside the box of how we kind of tackle this problem.
Yeah, I think, Nate, you said a great thing that hopefully during this whole webinar, you guys will start thinking about, is how do we think out of the box? How do we do that as a village here on this particular webinar call? So great call out on that. The other thing that's very important that we have here noted too is that the hospitals are starting to see the sickest of the sick, and a lot of the other cases now are going out to the outpatient area. So thank you for sharing those comments. Again, if you have anything that's a common trend that you're seeing that we're not seeing particularly, we'd love to see that in the chat. So on to the next slide. All right. So I'm going to quickly go a little bit, and then I'm going to hand it off to Nate to chime in, and Wade about it. We want you to know that you're not alone. So what you're seeing before you are statistics that are shared across the country on what we're seeing as SPD and OR struggles. Remember, we're looking at this from both sides of the tray. Certainly the volume, the shift to ASC, as we talked about, the nursing shortage, and the various citations that are done. So I'm going to hand that off to Nate, if you want to make a little comment, and then see Wade's thoughts on it as we're going through this particular slide.
Yeah, the growth shift, really one thing that kind of jumps out at me is a lot of those smaller procedures are shifting to the ASCs, and the big complex cases are staying at the hospitals, where, you know, the length of time, the sheer amount of instrumentation it takes to do a procedure like that that really complicates things, and you really have to have really highly trained people in SPD to really process those instruments, clean them properly, things like that. So that really, that shift actually, that is really taking a toll on a lot of the hospitals, because those big complex cases are staying at the facility.
Yeah, good point. And it's making a lot of pressure too on the smaller ambulatory surgery centers, which were not developed to have the bigger cases that they now see with the orthopedics and so forth. Wade, would you like to add some comments about anything on this slide?
Yeah, I mean, I think that's something, as we see that, I mean, there's been a growth, and there's going to continue to be a growth with surgeries and minimally invasive surgeries, the quick ones as well, going to outpatient procedure areas. And something that we got to be careful about is we need to, how are we going to incentivize our staff working in the hospital, in the OR and SPD? Because what we know with ASCs, typically, it's no weekends, it's no holidays, it's better working hours. So what can we do to better compensate our people at the hospital doing these more complex cases, working these crazy hours, try to reduce burnout, long hours, and frustration? So those are the things that I love it, because it was helping us moving some surgeries out to outpatient, but we also can't forget about the hospital too, of like, we need to keep those great people, like Nate said, like how do we keep and retain our top talent so we're not losing them and constantly dealing with turnover.
Yeah, that's a great point about, making sure both teams, whether you're into outpatient or whether you're inpatient, are, definitely being, incentivized to do it. And of course, we're dealing with, as we all know, not only SPD shortages, but nursing shortages, surgical tech shortages, anesthesia shortages. So there's just a lot of workforce shortages we're dealing with for it. Again, if you're dealing with a particular struggle that you are dealing with now and you're not seeing it here or again, write it in the chat so that we can take a look at that at the end of this webinar. All right. Let's talk about the two different worlds. I mean, that's what we came together for, was to really be able to understand the both sides of the tray, which I love the title. I think it truly just sums up exactly the struggles that we all go through in the procedural area. You have, and I'm started out with this here, the OR focus, where is the complex staffing, high acuity, and a lot of pressure. And the shared goal that they have with SPD is the same thing, right? It's process-driven precision and compliance. But if you put it together, they have a shared goal. And their shared goal is to be able to make sure that the work they're doing, which is attached to a patient and a loved one, is done at the highest level that it can be so that the patient has a good outcome for it. Anything you want to add, Nate or Wade, to this about talking about the different worlds and the same mission?
Yeah, I think we'll get into it later on too, but I think one thing that we have to really do is dive down and we have to appreciate what each other does, right? What function SPD does, what function the OR does, and one department cannot live without the other, right? And I'll die on this hill. I think that SPD is the heartbeat or backbone of the whole hospital, right? But they can't, they don't have a job unless we have an OR, and vice versa.
Absolutely. Wade, do you want to make any comment about that?
Oh, I mean, I feel the same sentiment. I mean, something that you see and that we've been lucky to have experienced in our careers is working in both areas. A lot in the OR, a lot in SPD. I started out mostly in the OR, and then now I'm mostly in SPD. So I see both sides, and really we have different struggles, but we have the same mission. Again, you can't have one without the other. There's things that the OR has to do to help out sterile processing. There's things that sterile processing has to do to help out the OR. And it's just to have that understanding and the empathy for the different roles in the different departments that I think is very crucial.
Yeah, that's a great point. We're going to be looking at right now, the next slide, we're going to talk a little bit about, what are the silos there and what are the pitfalls and what can we do to make an impact or a difference of it? Because we do have to work with the two teams being together. So again, if you have anything in the chat, please, feel free to write something down or a question that you may be thinking about as we go on to some of the common silo pitfalls. All right, so with this one being said, we're going to look at what this, why silos form, and then what is the impact on performance. So I'll start a little bit with Nate, if you want to. Well, actually, we'll start with Wade this time. Wade, would you like to talk a little bit about silos? You spent a few minutes talking about how the benefit we have in the work that we do is we're into all the areas. So we see it from different perspectives. So a little bit about some of the silos that you've seen formed that cause some of the pitfalls.
Yeah, thank you. So the very first one that we see on the top left, I mean, physical separation. I mean, that's the first part. You see most hospitals were built, OR is on one floor, SPD is on a completely different floor. So that's the main thing that we have to tackle at the very beginning is just that physical separation of each department. And we'll talk on later slides about how we fix this situation. But again, other ones are role misunderstanding, not truly understanding what we have to do, what the sterile processing department has to do. You know, it's like, oh, we send down that tray. How come it's not back up here in an hour? It's like, well, you know, we have IFUs to follow. We need to check it. We need to make sure everything's there. It's functioning properly. Sterilization time takes a long time. So it's just understanding the time that it takes. And then once you understand that other person's role, I mean, again, we see how it impacts, decreases employee morale. This way, it'll increase employee morale if you just understand what they're dealing with. And then what we see quite a bit is resistance to change. And we all run into this even in our daily lives, you know, but it's something that I struggled with at the beginning of my career. I was like, oh, why do we gotta do it like this? It was just fine before. But again, things change. And especially in our world in healthcare, things change all the time. And it could be COVID-19, it could be a new president, it could be a new IFU that comes out. So we have to constantly evolve and be able to listen to other people's opinion, not get offended. Let's just listen and let's do what's best for the patient.
Yeah, that's a great point, especially about the changes we're dealing with every day. I mean, everybody knows on this call that an IFU comes out every single day with a change. So we're constantly dealing with that. Nate, do you want to add anything about how those silos that we see on the left affect the performance?
All great points, Wade. I think that you know, again, we have to have a general understanding of what each other does in their departments and appreciate that, right? And that helps with that you know, understanding of what each other does. I think that can help break those silos.
Agree.
Yeah.
All right. A lot to be said about that. Now, with the next slide coming up, we're going to be looking again at the, wait a minute. Hang on, do I have the right slide? Hang on, right there. Okay, it's ways to improve these breaking down silos. Sorry, hit the wrong button, wrong way for it. So when you look at those different silos that Nate and Wade have pointed out, and again, it also goes back to the different multi-generations that are working together. Everyone has a different way of working and also a different attitude towards work. One of the ways that we've been looking at is how can we break down these silos, which we're hoping that you'll get some good takeaways from that today. So with that being said, Nate, you want to start us off on some of the ways we can break down some of those silos?
Yeah, I think one thing that I see that's really working is having team meetings together, right, with SPD and sterile processing. But you have to be able to have those meetings where it's a neutral zone, right? It's a no judgment zone is what I call it. Is everyone has to understand that we're in there to discuss issues that we're having together, right, and come up with a common denominator with the issue, right, and a common goal to fix the issue. I know as sterile processing techs and surgical techs and nurses, we're all very passionate about what we do, and that passion sometimes enters those meetings, and it feels like that one person is finger pointing and things like that, but in all actuality, you're really in there for one common goal, to figure out those solutions and to break those silos and to just create a uniform working environment between the two departments.
Yeah, great
Wade?
point about that. Wade?
No, I agree with that. And another one that I'll put were staff recognitions is like nominating somebody from a different department. Like when I talked to the previous one about physical separation, right? Some of us are very lucky and OR and SPD are on the same floor. And the hospitals I've seen where it's on the same floor and they're next to each other, typically it's a better working environment because they're eating lunch together, they're talking with each other, and they understand each other more. But to break the silos of the physical separation, maybe nominating somebody from the opposite department. surgery.
Great point. Yep.
Yeah, surgery nominating somebody from SPD that month, giving them recognition that they see the great work that they're doing, and somebody from SPD acknowledging somebody from the OR. Say, yeah, we really appreciate, this circulator coming down and helping us put some trays together, or helping us know exactly what do they want in these trays, and then you nominate, and that can bring and increase employee morale.
Yeah. And, Linda started us out, as you all remember, with the question about Pancreatic Cancer Awareness Month. There's so many walks that can be done, like breast cancer awareness, Alzheimer's, maybe doing a team function where you get the two teams together to do a community event, even much more opportunity for them to learn each other outside of work, which makes the work at much more collaborative when you're at work. So great thoughts on that. All right. Again, any ideas you have, anything that you guys have done that have really made an impact on breaking down silos? We welcome that again in your chat so we can learn ourselves from you. All right. The next slide that we're looking at are leadership strategies to align those goals. Wade, you want to start us off a little bit on some of those strategies that we've worked on as a team in our organization and throughout our hospitals, and some that might work for some of you out there?
Yeah, absolutely. Again, you see OR SPD daily meetings. It's when you have that voice at the table, putting feelings aside, and just focusing on the combined mission. Like, what are we going to be running into tomorrow? Let's go over it. Is it, oh man, this sterilizer is down, so we're going to have to do more trays. In the middle of the night, we're going to beef up staff. We just want the OR to know so they can be prepared. Oh, we only have this many trays. Can we schedule, instead of them back to back, can we put something in between? That way you minimize the delay, and it makes the patient happier and the surgeon happier. Because again, these are for the patients. We got to think about them. It's even us that work in the hospitals, even we are probably getting nervous waiting there, but somebody that isn't familiar with surgery, and they're sitting there in that waiting room just super nervous, if we do anything in the OR SPD to cause a delay, that's just making it longer for them. They're getting more nervous. Yeah. So us having these daily meetings to make sure the next day goes perfectly smooth, it's not good for only SPD and OR, it's good for the patient. And that's what we're all here for.
Absolutely, and their families. Absolutely, they're waiting, they're very stressed over it, and they don't know the delay is caused because we had something missing out of a tray. It's a great point.
Mm-hmm.
All right, Nate, you want to add anything to this? I know there's something on here that you're very passionate about.
Absolutely. I just think that we as leaders need to create a culture of where people could come to us and feel like that they are heard and validated with their concerns. I think that that's important. We may not be able to implement what their concerns are, or things like that, but just give them a platform to speak. And that's one thing that I've working over the years for Betty, when she was a VP of Surgical Services, as a customer of Surgical Solutions. That's one thing I really appreciated about her, is she made sure she had an open door policy for anyone to go into her office and to speak to her, to make suggestions, things like that. And really, she was always in scrubs, and she was always making rounds to make sure that everything was buttoned up tight. And I think that that's important for your employees to actually see you out on the floor as well. That goes for SPD leadership as well as OR leadership.
Well, thank you, Nate. I did not pay Nate to say that, so I just want you to know, but thank you very much for that.
Oh, yeah.
For it.
She paid
but, yeah, right. I wish I could pay my light bill to currently get these lights on for it. But, it is very important as leaders that we do have that open door policy. So that people can share. I think you guys did a great job of articulating that. Thank you. Again, if you're doing something that you're doing now in a strategy to break down those silos and help align those strategic goals together with both teams, please, we welcome it. We're always looking for good ideas, again, for ourselves and our work. And I know the rest of the team that's on this webinar will appreciate that. So with the next slide, we're going to go through ways to continue to improve the breakdown of the silos. With that being said, Nate, you want to jump in on this one?
Yeah, I think what we need to do is, I see a lot of hospitals when they're onboarding new nurses and when they're onboarding new SPD technicians, they they do a pretty good job of bringing the nurses down and put together trays and things like that. And then SPD, they bring a technician upstairs to watch a few cases and things like that. But I think that we're missing a great opportunity here, to really to strengthen both departments and really show them exactly what a nurse does for an SPD tech, and what an SPD tech does to a nurse, right? I think putting together trays, things like that, that's great, but I think that you have to really expand on that, and you have to have the nurse work in decon and see exactly what goes in decon, and what why instrument trays need to be processed the way they do, or why instruments need to be put in the correct containers, and why that takes so much more time to process instruments, things like that, to give them a true appreciation of what each other does, and not just sending an SPD tech upstairs to see, or to the OR to see an OR procedure or two, right? Follow the nurse for the whole process, follow the surgical tech through the whole process to really see what they do, and give them a greater appreciation. And that, I feel like it would create more cohesiveness between the two departments.
That's great. Before I go to Wade on this, I just want to share what was a best practice that I learned from a previous customer, is that they had the SPD person, when they were shadowing the OR work, they actually had them go out with the OR nurse and meet the families with them. And it made a huge difference, because now they're putting that human component into the work that they do, and it made a big impact. Matter of fact, that person went up into leadership and actually worked with the OR leadership to continue that process for it, because they wanted their team to understand that the work they do is so vital, so important, and that it's attached to someone else's loved one. And that's a good start. Maybe just when you're shadowing, is to have them go out and see what, the families, how they're, with their families going in to have procedures. So thank you for sharing that. Wade, do you want to add anything to this particular slide?
I mean, I think this is something that's all three of us think is extremely important. I love that, of like somebody from sterile processing following the nurse to even see the patient and their family, and then go to the room to help open up the room. So you can see, we've opened up rooms before, and you open it and you check the wrap, and you're like, oh man, there's a hole in it, and didn't have protectors. Oh man, there's not an indicator, things that go wrong, and you see the frustration. And then, I always worried. I put together trays and I opened up the room. So when I would see that nurse or surgical tech open it up, I mean, I knew it was good, but you still get a little nervous. You're like, oh man, I really put that indicator in, because it does.
Did I put that indicator in?
Yeah, it can cause a delay. It causes frustration. And then but honestly, it helped me out, because I knew how important it was, because I did not want my name on something that they were going to open up, and it was going to cause a major problem in that OR that day. And it goes back to these three things that we have here: listen and observe, collaborate, align and empower, be visible leaders. It's like, put together some trays so you see what your staff are dealing with. Go in and do that type of work so you see the problems, and listen to them. Have meetings with the OR and SPD, and then align and empower, have shared goals, and celebrate your wins.
Yeah, it's a great point. And if you want to start it just start it out with your leadership team and say, you know what, I'm going to go and round on my families today having surgery. Come on up here with me, my SPD leader. Let me introduce them to the good work that you and your team are doing. The more we get that out, the more we'll be able to make even more impact on our patient outcomes. So thank you for sharing that. Again, if you're doing anything, again, with best practices, please share it with us. We appreciate it. Next slide talks about continuing ways to improve, breaking down those silos. We'll start out with you, Wade, talking a little bit about, I know, things that you've been working on with your teams, and some, especially the communication and stuff. You want to speak a little bit about?
Yeah, and honestly, something that we have been doing is, say, a quarterly newsletter. That's one thing that we want to talk about, the great work that the staff are doing. We want to celebrate our wins, and just let them know with data as well. What are we doing better? More cohesion, being on the same floor. That's another way to improve. This is more of a recap, but and unity. Discuss challenges and solutions that improve efficiency and patient outcomes. Yeah, we need to talk about it. If we don't, it's just going to keep having problems day in and day out.
Yeah. That's great. If you guys are doing newsletters now in your departments and are thinking about that, we would love to hear some new ideas about that. So please write that down in the chat. Sometimes newsletters can become a little bit redundant, so we'd like to add something to that. So if you have something great you're doing, we'd love to hear about it. Nate, do you want to add anything on this before we go to the next slide?
Yeah, I think we've spoken about it before, but I think that you really just have to foster that communication between the both OR and SPD, and that's through just team meetings, no judgment zone, common goal to find out why something is happening and how we fix it. That is just so key, and that's the reason why I keep hitting on that, is because I see that across the board that we're not doing enough of that to make sure that we are working as one unit, basically. And I think if you have to think of it that way, whenever.
Absolutely. All right, as we go to the next thing, I have to start out with Nate, because the very first thing is something that really drives his passion, and I totally agree with him for it. But Nate, you want to speak to us a little bit about when you elevate your own role and the clinical ladders?
Yeah, so the clinical ladders is something that we started working on in our own company a few years ago, and we kind of talked about it a little bit before, but it's something I'm super passionate about, and Wade and Betty are super passionate about it as well. As we saw really the need to elevate folks in our organization, and I see the need actually in SPD departments as well. And we can apply what we've done with our company to other SPD departments, and with success. And again, you don't have too many leadership positions open, but you have people that want to grow within the organization, and we all have retention issues, right? So what we did was create a clinical ladder. We have a Tech 1, Tech 2, Tech 3, and you progress throughout. It would take probably about 3 years to do. That's typically what our technicians, how long it takes them to do that. But you get incremental wage increases as you develop, right? So it really works in a twofold for us and the employee. We're investing in the employee's education with additional certifications, things like that. And then it's helping us because we're retaining the employee as well. So this is something that's really working for us, and I think that it can really work in SPD departments across the country.
Yeah, I think that the OR has been, ahead of that in some having clinical ladders, both for nurses and some of them for techs for it. But if you can mirror that clinical ladder into your SPD department, it also makes a huge impact. Wade, do you want to add anything on here? I know you're very interested in, and compassionate about the pipeline for different career levels that SPD and even the operating room can serve.
Yeah, again, you need to have a pipeline. You need to have a solid recruiting base, because again, you're going to lose some of your best people. Some of your best people that have been there 30 years. One day they will retire, as they should, because they put in a lot of hard work. But how do you replace it with somebody that's quality? It's career fairs. It's getting your organization's name out there. It's, again, celebrating your wins. I think another thing that's huge and that we've seen at the places that we've gone to, it's culture. The money and the raises, it can be very difficult to do financially. We always want all of our people to make more money because they deserve it. But you also need to have a great culture, because what's up with making more money if you don't like working there? So again, celebrating those wins, having a culture that people want to work at, because you want them to be happy as well. But again, go to career fairs, have stout training programs. When they start, what does your training program look like? Are you just throwing them in, or are you making sure that they're going to be successful in their first month, their first 3 months, in their first year, and so on and so forth? That way, when you do lose that person that's been there for 30 years, you can kind of put that into your new people that come on board too. That way you're not losing that institutional knowledge near as much.
Yeah, that's great. That institutional knowledge is very important. You know, the other thing to do too is to sit down with your team, you know, your team member on a one-to-one in both the ORs and SPD, and really say, what is your 2, 3, 5-year plan? Because, you know, life gets so far ahead of us that the next thing you know, we've been in the same role for 3 to 5 years and nobody ever stopped to ask, what do I see myself in the next 3 or 5 years? So it's a good idea, especially for those of us who are leadership here, to really have those crucial conversations with our team and say, where do you see yourself? And what can I do to help you get there? And really take it as a compliment when they do move through the pipeline, you know, and one of your nurses becomes a CRNA or an anesthesiologist, or one of your SPD techs goes back to become a surgical tech or a nurse. That's something to applaud. That's a big example of what your culture has done to that person. So be proud of it and not like, oh gosh, I'm losing another one to school, you know. Whatever you can do to support that makes a huge difference. And tribal knowledge is very important to make sure that, you know, for those who are in there, just, you know, just try to make them comfortable with sharing it. We're not sharing it just to replace you. We're sharing it so the patients are cared for. So thank you for that, guys. I appreciate that. And we'll go on to the next slide. I think the other thing we're going to talk about real quick is how do you measure success, right? So I'm going to just kick off real quick, and then I'm going to hand it off to Wade and Nate to add their input onto it. But, you know, what are you doing to, are you tracking your hospital's performance, your department's performance, you know, or just simply guessing on what's working and what's not? Are your teams involved with developing KPIs? I love to talk about this sometimes with new people, new teams that we get, or new partnerships, and say, you know, when's the last time you asked your team members what did they see this department, what did they need to do to make this department feel successful? And you'll be surprised what they'll tell you. Lots of times it's what you really need to be tracking, right? For it. It could be, you know, how many days did we work without an unsafe event, or a tray that was returned that was inaccurate, you know, those types of things. Some hospitals don't measure their performance at all. And without measuring the performance, you'll never know if you're going to be good, if you're really in a good spot, or you just think you are. So get your staff involved, get your team involved, sit them both down and say, give me 1 or 2 examples that we can measure ourselves as a team. Again, it could be accuracy of trays, or it could be pre-spraying that it comes down and correct. So with that being said, I'm going to ask if Nate or Wade have anything that they would like to add to this. And again, if you're thinking about, you have a great KPI that you're measuring, please, by all means, you know, just go ahead and share that with us in the chat line. All right, Nate, you want to start?
Yeah, I think.
Anything to add?
Yeah, I think just really to reiterate what you said is really just you've got to start somewhere, right? A lot of people just they don't track anything, right? So you've got to find a baseline, and you've got to track something. I think that's important with incomplete trays, bioburden in trays, different things like that. I think that's super important to go and find the baseline.
Yeah, great point. Wade, you want to add anything? And I'll give you an example of what a great KPI is that you can get both teams involved. Go ahead, Wade. Do you want to add anything?
Yeah, no, I mean, this is extremely important. I mean, you have to measure your productivity, your turnover. You have to do measurements. Why? Because when you do have these staffing issues and retaining issues, you want to see, like, this is how much we're getting down. This is how much our staff is actually, they're exceeding the benchmark of what a technician should be able to do in an hour, in a shift or something, but we have way too many trays coming down. If you just say it sometimes, and that's any problem that you're dealing with, if you just voice it, because you hear so many times, oh, I've told this person, oh, I've told that person. But if you have that solid data to show them as well, that can make it even quicker to make changes. And if you did make a change as a leader, say, oh, okay, I did this in service with my staff, you know, we were, you know, assembling this tray wrong. I did the in service. Now we, you know, and you track like your tray defects. Now you see after you did this new process or in service, you can see how it's improved. And that just shows this, what you've done as a leader to help out your team, to prove it, instead of just say that you did something.
Great point. No. One of the things you can do to bring both teams together is that you can put together a tray tracer and trace the tray from the time it's in the operating room all the way down to the SPD, and have one team member from each team work together on that. And that way then they can see each other's work and actually be a part of that process. I know we're getting short on time, so we're going to head off to the next slide. The next slide is just looking at examples of improving your hospital's performance with data. What you're seeing in front of you right now is actually data from our hospitals that we work with for it. We're kind of unique in the fact that we have many hospitals across the state, and we're able to benchmark our hospitals with each other, and we're able to benchmark our hospital in just the actual hospital that we're at. So this is some of the proprietary examples that we use and some of the KPIs that we do and some of where our data is. We thought it would be important for you to see that, you know, kind of if you're going to talk the talk, you have to walk the walk. And this is an example of what we do in our own work to show you how we monitor our trends. And when we do tracers with somebody from the OR and somebody from SPD, and they do it together as a team so they can trace the trays and make sure that all processes are being followed. So with it, anything you guys want to add on before we go to the next slide?
I'll say just real quick, it's just very important. It's actually helped us a lot tracking it, and this is being our dashboards that we've been using, but it's also looking at them and is it something that's helpful to us? Because it's not, let's stop tracking it. Let's not waste time tracking it anymore, and let's track something else that actually will be helpful. So be willing to pivot.
Yeah, thank you.
Absolutely, and just to add to your point, make sure that there's something that's meaningful for your organization. Something that's meaningful for one organization may not be what's meaningful for the next. And I think that that's important is, you know, we can all be data collectors, but we didn't get into this business to collect data all day, right? We got in this business to take care of patients. And that's super important. We can get kind of sidetracked in collecting data all the time, but that's not why we're really here, right? So just pick the 4 or 5 things that are really important to your organization and track those.
That is really, that's one of the best points I hope you can remember from this particular webinar is when you're doing your KPIs or doing any of your performance metrics, make sure they're meaningful. That way people do see a value and they'll really want to be a part of it. So thank you for reminding us about that, Nate. Really appreciate it. All right, we'll go on to the next slide. Again, if you're doing anything great with your KPIs, love to hear some ideas about something new and fresh out there for it. So when do you know when it's time to get help? I think we can sit and we can try to think that we're going to solve our issues and make a difference in the impact, and we get all excited and all jazzed up and ready to go, and then we're still back into the same hamster wheel. So Nate and Wade, if you guys, Wade, if you want to comment first on some of the things that, you know, you recognize that it's time for you to go get help, and what would that look like for you?
I mean, a lot of you probably already know. It's just, it's when everything, you have way too many trays down, you have way too many defects. But again, a couple of the points that we put on here is, are you reacting to problems instead of preventing them? That's, I think, a very important one, is that if you're always reactive, then that means you do need help. And what Nathan said right before is your team spends more time collecting data rather than acting on it. It's great to get it.
Great point.
Doing anything afterwards, what's the point?
Yeah. No, thank you for that. I think that really kind of ties this presentation up for it. And it's not bad to ask for help for it. I think that, you know, asking for help, you can learn from someone else. You can attend webinars. You can ask people to contact you and give you suggestions. There's all sorts of things that you can do. Nate, you want to add anything before we go to the next slide?
I think if you see where you are having constant turnover and your turnover is high, I think that's a point when you ask for help, right? Or you start asking the questions. Why are we receiving this turnover? What can we do to fix it? I think that's a huge thing. That's something that glares on me. I see every day as just the staffing crisis. That's when you ask for help, because whenever you're critically staffed, you're rushing processes, and that's when mistakes happen. And it absolutely can actually crush days, crush months of a hospital's productivity.
Thank you for that. So you're not in it alone. So our next slide just kind of really recaps that, as we thank you for, of course, your time. We'll have the last 10 minutes to have questions and answer period from the chat. But the next slide talks about you're not alone, and you don't have to do it yourself. Every hospital is facing these challenges, And it's not a failure of your leadership. It's just giving you an opportunity to look at things differently. One of the things to learn is to go back into your offices or when you get your downtime and really reflect upon what's really going on and what can I do to make an impact, or who do I need to seek out help. We want you to understand that you're not, again, in it by yourself, that we're here also as a company if you ever need help for it. We're here to help and to help you focus on what matters and to make better outcomes for your patients and your team. So with that being said, we'll go to the last slide, which is a big thank you. My power did come on, but I didn't want to disrupt the call for it. So maybe I can do it while we're doing the question and answers, and so you guys can see I really exist. But again, on behalf of myself, Nate, and Wade, we thank you for your time, and we're going to hand it off, I think, to Linda to see what's in the chat for us.
Yes, thank you so much, Betty. Before I ask some questions, I'll just read some comments that have come through. There's some big thumbs up for your suggestions about SPD visiting the OR for a day and vice versa. People are saying it makes a huge difference in understanding and giving respect for each other. Another comment is perhaps a clinical ladder for staff as they get increased certifications, leader positions. Compensation is huge, always has been, so let staff work the shifts they want to work, and leadership must support staff. So they were subjects you touched on. So one of the questions that has come in is, what was the most challenging silo that you had to bring down, and how did you succeed?
Oh, I'm going to let Nate and Wade add their opinion on that. I'd have to think about all these years. So I'd probably, the webinar would be over by then. So Nate, Wade, you guys want to talk about one of your greatest silos that you had to
I think
kind of plow through?
I think you know which one I'm going to refer to, and I'll kind of play off of you too, Wade. I think a particular hospital we were at a couple years ago, when we walked in, we asked the leadership there, how's your culture? And these folks, they said, culture is the worst I've never seen culture this bad, right? So when we walked in there, we knew that mission number one is to help improve that culture. And I kind of let Wade kind of dive into that a little bit, but we really, you know, I feel like that the people there didn't feel like that they were heard at all. They feel like that they felt like that the OR thought that they were just dishwashers, right? And we know that that's not the case. We're not just dishwashers. There's science behind it. This is truly a career now. 20 years ago, maybe not, but now in this day and time, this is truly a career, right? And those people, we gave them a platform to be heard, and we had consistent meetings with them to get their feedback. We implemented a lot of their suggestions because they were great suggestions actually to implement. So I can turn it over to Wade, and he can elaborate a little bit more about that particular facility.
Yeah, I mean, it's funny because that was, I mean, it was more in the more recent. We have plenty of examples, but that's a big glaring one that, yeah, the culture was a big problem. They had many other things, you know, equipment, lack of space, things like that. But step one was like changing the culture. And how did we do it? We had huddles with our staff, and we had meetings with the OR. I have amazing jokes that every single person loves, and I would tell a joke during the huddles too, to kind of lighten the mood. But it was also gaining trust. I think they had a lack of trust from previous leadership, and letting them know I'm here for you. And I didn't spend all my time in the office. Most of my time was out on the floor. They saw me wiping down case carts, putting together trays, running around, answering the phones, you know, delivering stuff to the OR. I was speaking to the surgeons if something was wrong. So being that face, taking those bullets for them, and being their voice, because they weren't listened to before, and it's like stepping up for them. And it really helped improve the culture there, improve their trust and leadership. And it's something that it took a lot of hours, but it's something at the end when it was done, it got a lot better, and something that when you don't realize it during the time because it's so draining and exhausting, but I did see a major difference after we were done.
They could feel what we were doing. That you didn't even have to talk about it, right? They could feel it because we could say we're going to do X, Y, and Z, We didn't really do that. We just showed them. We led by example, and that really broke that cycle of mistrust with management and mistrust with the OR, because we started bridging that gap between the two areas, and it was a beautiful thing.
And you know what they failed to really tell you is the real output of it is that they were able to be role models, right? This particular hospital didn't have good role models in either of the departments, and either the leadership or the staff. And to be able to see a team come in and be able to help them see what good looks like and experience that, they took it and just ran with it, and today still flourish with it. So it's all about, you know, making sure you have the right people, right thing in place, and you're listening to your team. So great example of that. Any other question, Linda? That was a great question, whoever asked that. Thank you.
Well, there's been several questions about senior leadership listening to suggestions. So even when people try to get the senior leadership to listen, how long do you think it will be until you see change in your experience?
You know, actually, I'm going to take that on to begin with, because I know what it's like to work my way up to that senior level, and I've always appreciated how I did get the pathway there for it. The one thing to do is, I would say, is invite them to come down. And I'll tell you, lots of times they are hesitant because they're scared. I remember a CEO that I worked for, he goes, you know, Betty, he goes, I kind of always wanted to go behind that red line, but I was scared. You know, I thought maybe what if I pass out? Y'all will laugh at me, all this other stuff. But eventually I convinced them that, you know, let's just go out together and just walk, put some scrubs on, let's walk around, let's chit chat, let's learn. And he learned so much and valued the work that was done, both in the OR, and then we went down to SPD. So, you know, one of the things I would say to your leadership is to say, you know, round with me, right? Come to one of our huddles, right? If you don't have to do anything, just listen, just be there to participate. Once they get comfortable, and lots of times they're not because they're not comfortable, but once you get them comfortable and going down, you will see a big change of how they can take change and be able to implement it and advocate for you. Lots of times these senior leaders haven't been behind those closed doors. So whatever you can do to get them to come down, you know, just encourage them for it, and you'll see a big difference. I don't know if Nate or Wade, you guys want to add anything else, but that's one thing that I do to get the CEOs to come down when I'm in a hospital.
Yeah, I can go first. I mean, that's where I go back to the data as well, because again, I can talk and say this is what I need, but I really need data to back me up too, because I know they're busy, and if I can shoot that over to them and tell them what it means, the numbers that I'm looking at, and so they understand it too, that helps speed things along.
A great point about the data. Yes, absolutely.
Absolutely. Just really generally getting them engaged, and then keeping them informed of what actually is going on in the field, right? I think that's important, and getting their buy-in.
And when you get a win, thanking them. You know what I mean? Thanking them for the wins.
Absolutely.
A lot of times a lot of times senior leaders don't get reward and recognition either. So it's really nice to be able to also, you know, spread that up the chain as well as down. So great question, whoever asked that. Thank you for that. Another question, Linda?
Yeah, we've got time for one more. Where is the best place to get benchmarks for SPD?
Well, that's a good question, you guys. Nate, you and Wade want to try that? So we can go into the usual spots that you can go and get stuff.
I would say Amy's a good place. HSPA is a good place.
Great place. HHPA, that's what I was going to say. ARN is another one.
Yeah,
to get some benchmark data.
Absolutely.
Also, you know what? Just hanging out on LinkedIn. You know what I mean? Putting yourselves out there. We're out there. Please befriend us on LinkedIn. Befriend us as a company on LinkedIn. You will be in the circle with everyone else, and you'll see a lot of data shared there for it. There's constantly data. There's also data on emotional intelligence that's out there as a leader. So if you're not on LinkedIn, I'm going to give a pitch for LinkedIn. Get yourself on LinkedIn. Befriend us on LinkedIn. We will show you places we can get data from. I'm happy to do that. You can also reach out to us, and we're happy to help you. That's what we're here for. Sorry, I had to say a pitch for LinkedIn.
Perfect. Thank you so much. Unfortunately, our hour is up. So thank you all for your time today and for such a great and really informative presentation. Thank you. If you'd like more information about today's presentation and sponsor, please visit surgical-solutions.com. Now, as promised, the answer to today's trivia question is purple. So congratulations to our winner, Charlotte Dorsey, here in Georgia. Now, just a quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your certificate, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Please visit OR Today Webinars Live for more details of all our upcoming webinars and, of course, complimentary registration. Now, just a quick reminder that if you've missed any of our past OR Today webinars, again, you are still able to view them on our website, ortodaywebinars.live. So thank you all again for your time today, and I hope you all enjoy the rest of your day.
Thank you.
Thanks, everyone.